My name is Javier Fleites, and this is going to be my video recording for my OSCE number 4. This is based on internal medicine, case number 8 on page 106 about Mr. Brown. And this is going to be my examination area here. This is going to be my patient, Mr. Rosette. This is my examination area here. Okay, we're gonna be starting the recording on the minute number 1. Make sure that we can cover. Okay, we're ready. Here, okay. Our case today is about Mr. Michael Brown, 55-year-old male construction worker who is coming into the office with abdominal pain. He has a past medical history of hypertension, which is controlled with ACE inhibitors. Okay, Mr. Brown, my name is Javier Fleites. I'm a PA student, and I'm going to be helping you today. What brings you into the office today?
I had been having a pain on my belly.
Okay, and when did the pain start, Mr. Brown?
It had been about 2 months.
Okay, can you tell me with one finger, can you point me out exactly where the pain is located?
Is it here on the upper part of my abdomen?
Okay, and can you describe, is it constant or is it intermittent?
Mostly it's all the time.
Okay, can you describe the pain for me?
Is it burning, non-knowing, and in nature?
And does it radiate anywhere?
No.
And had you noticed anything that makes the pains worse?
Alcohol, coffee, smoking, stress, and no eating make it worse.
And anything that you think that's making it better?
Food and antacid help.
Okay, and in a scale, Mr. Brown, of 1 to 10, with 1 is going to be the lowest grade and 10 is going to be the highest, how would you grade the pain?
Is it a 3?
Okay, associated with this pain, had you had any nausea or vomiting?
No.
What about any change in your bowel movements?
No, I have no diarrhea or constipations.
Okay, have you noticed any blood in your stools or tarry stools?
No.
Okay, what about any weight loss
No.
recently? Okay, you told me you consume alcohol. And how much alcohol do you drink?
Just a beer on Sundays.
Okay, what about smoking, tobacco
I
use?
smoke a pack of cigarettes a day.
And what about any regular use of NSAIDs or aspirin?
No.
Okay, thank you for the information, Mr. Brown. Now I'm going to be washing my hands and I'm going to proceed to the physical examination. You can lay here on the examination table and I'll be right back with you. So I'm going to remove myself, wash my hands, and I come back ready for the physical exam. Okay, patient, first of all, we're going to be checking for orthostatic changes. For that, we're going to be checking blood pressure in 3 different positions: laying, sitting, sitting, and standing. And we're going to start with the blood pressure in supine. Okay, now we're going to do it in sitting position. Just relax your arm. Okay, then we're going to perform in standing. Okay, after checking the blood pressure in supine, sitting and standing, there's no orthostatic changing. We're going to be looking in here for any drop in systolic more than at least 20 milligrams of mercury, and at least 10 milligrams of mercury in this diastolic with any of the position changes. We're checking for compensatory response from the cardiovascular system. Okay, then we're going to have the patient lay in the examination table again. We're going to dress him appropriately with the drape. We're going to cover him appropriately, and we're going to uncover the abdominal area. First, we're going to start by auscultating for vowel sounds on the 4 quadrants. Then we're gonna perform light palpation in the 4 quadrants and the epigastric region. The area of pain is the epigastric area, so we're gonna leave it for last. Any pain in here?
No.
Here?
No.
Here? What about here?
No.
What about here?
Yes.
Okay. Pain elicited in the light palpation. We're gonna do deep palpation, the 4 quadrants too.
No.
Any pain here? In here?
No.
What about here?
No.
What about here?
No.
What about here?
Yes.
Okay, pain elicited in the epigastric region with light and deep palpation. Okay, thank you, Mr. Brown. With all the information that we gathered today, that you provided us and the information we got from the physical examination, we're ready to give you some differential diagnosis for your condition today. First, we strongly think that you're suffering from a peptic ulcer disease. And secondly, we think it could be gastritis. It could also be a non-ulcer dyspepsia, or it could be a pancreatitis. Also, it could be a malignant process in the GI tract. But we strongly think, in the first place, it could be a peptic ulcer disease. To confirm this, we're going to run some tests that's going to help us confirm what you're having today. First, we're going to do a CBC and fecal cord blood. This is going to help identify any bleeding in the GI tract that is not observable with the naked eye. Then we're going to perform the test to check your pancreas enzymes. That's going to help us identify if there's any inflammatory process in the pancreas. We're going to see also, we're going to order an upper tract barium studies or GI of the upper tract series, and that's going to help us identify or see if there's any ulcerative process in the GI tract. We are going to order a H. pylori urase breath test, and lastly, we're going to give you a referral for a GI specialist that's going to help us perform an endoscopy and confirm the diagnosis. It could also confirm H. pylori presence by doing a biopsy of the gastric lining. Okay, once we have the confirmation of your process or your condition, what we're going to recommend, first of all, is going to be lifestyle modifications. First of all, we're going to stop any alcohol consumption, smoking, any caffeine intake, NSAID use, spicy foods, because what is an ulcer? An ulcer is just an ulcerative process. It's like an opening in the lining of the GI tract, and this is what's causing the pain, which is usually worsened when the gastric produced by the stomach or the digestion goes through. And first of all, once we have the confirmation that there is an ulcer, there is 2 main processes that cause an ulcer. First of all, it could be the frequent use of NSAIDs or non-enteric coated aspirin, or it could also be caused by a bacterium that can reside in the stomach, which is called H. pylori. Once we have the confirmation that you have an ulcer, we can identify the cause. If there is an NSAID or aspirin use, we're going to stop those, as we recommended before, and we can use an histamine 2 receptor antagonist like cimetidine or famotidine that can help alleviate the process and get better. And if it is H. pylori, we can do a triple therapy or quadruple therapy. These therapies consist of 2 antibiotics and a proton pump inhibitor. In this case, we could be using, for example, clarithromycin and amoxicillin and omeprazole. You're not allergic to penicillin, are you?
No.
Okay, we can use that, or we can do the quadruple therapy, which is usually use tetracycline, omeprazole, metronidazole, and bismuth subsalicylate. All these therapies are very effective and can help you stop the ulcerative process and are going to help you get better. The first step is coming into our office, and taking the first step is important, since starting these therapies early can stop the growing process of the ulcer, and it's going to help you get better. All this process can be stopped totally. We can address it appropriately, working with you, and we both can help you feel much better than you're doing today. We're sorry that you're feeling sick. Do you have any further questions for us?
No, thank you.
Okay, thank you very much, Mr. Brown. We're gonna get the papers ready for your test. We're gonna give you the paper for the test, and we're gonna give you the referral for the GI specialist, and we're gonna have you come back as soon as the tests are performed, okay?
Okay, thank you.
Thank you very much and have a good day.
Thank you.